one hand, cases in the country are leveling off at rates just on the cusp of potential to resurge, and the B.1.1.7 hypertransmissible variant looms ready to hijack our successes to date. And on the other hand, stamina has worn thin, fatigue is winning, and the exact measures we have taken to stop the pandemic are now too often being flagrantly ignored. All the while, we are just on the verge of capitalizing on the culmination of a historic scientific success, the ability to vaccinate the country in just a matter of 3 or 4 more months. How this plays out is up to us. The next 3 months are pivotal. I'm asking you to reach deeply to protect our nation's health and to protect your loved ones. Whether mandated or not, as individuals and as communities, we can still take the right public health action to protect ourselves and others. Wearing a well-fitting mask, avoiding travel in crowds, social distancing, and practicing good hand hygiene. Now more than ever, we must do all we can to stop the spread of the virus. As I said on Monday, we now have a third safe and highly effective vaccine following the emergency use authorization by the FDA and the recommendations for use by the Advisory Committee on Immunization Practices, or ASIP, of the Johnson & Johnson COVID-19 vaccine. We saw footage of the first doses being administered yesterday, less than 48 hours after ASIP recommended its use, just as Andy commented. This is a remarkable achievement. With the additional vaccine, more vaccine doses are making their ways into communities, making it possible for more people to get vaccinated and protected from COVID-19. And because this vaccine is a single shot and is easier to store and transport, we can provide vaccines in more communities and mobile sites moving forward. Yesterday, CDC released an MMWR article detailing the clinical trial data on the demonstrated safety and efficacy of this newly authorized vaccine. The report also provided important guidance for clinicians who will be administering it. The report reflects the in-depth discussions held during the emergency ACIP meeting this past Sunday and Monday. CDC has now also updated its website to provide easy-to-find information for both healthcare providers and the public about the new Johnson & Johnson vaccine, including information people should know before getting a vaccine. I encourage you to check out our website to learn more. But the message I want you to hear from me today is that we now have 3 COVID-19 vaccines that are all safe and highly effective. And the most important thing you can do is roll up your sleeve and get vaccinated with the first vaccine that is available to you. Finally, I want to share how proud I am that CDC is taking a leading role in helping to achieve the President's initiative to get educators and all school staff, including childcare workers, vaccinated. I look forward to working with our pharmacies, state, and local partners in the days ahead to move this critical work forward. Thank you. I look forward to your questions, but first I'll turn things to Dr. Fauci. Dr. Fauci?
Thank you very much, Dr. Walensky. I'd like to spend the next couple of minutes addressing the issue of the SARS-CoV-2 variants and what the multifaceted approach towards addressing these are. If I could have the first slide. This is a list of the variants that we have been discussing over the last several weeks. Just very, very briefly, you know, the 117, which was originally in the UK, has the characteristic of increased transmissibility. It's covered relatively well by our current authorized vaccines. More problematic is the South African 351, which is moderately to severely reduced vaccine efficacy, about 5-fold or so. There's the P1, which originated in Brazil. Again, some preliminary reports of increased transmissibility, and antibodies elicited by previous infection or vaccine may be less effective. In our own country, we have the 427, 429 California variants with preliminary reports of increased transmissibility and disease activity, and the New York 526, which recent studies show variable loss of neutralizing activity by some monoclonal antibodies as well as vaccine-induced antibodies. So what is the approach? The approach that we have currently and for the future is really 4-pronged. I'll go very briefly through each of these to give you a sampling of the kinds of things that are going on and that you can expect. The first being the ramping up of the vaccination with first and second doses of current EUA-approved vaccines. I can show you on the next slide. The next slide, can I have the next slide, is an example here of a Pfizer-BioNTech vaccine, namely looking at neutralizing antibody titers after the first and second dose. If you look there at day 21, which is at the time that you would be giving the second dose, the antibody titers that are there are good enough to suppress infection, but to some extent. I mean, when you look at the data of the degree of efficacy that you do get after one dose, but take a look at what happens after the second dose. The degree of increase is at least tenfold in both of these age groups that was studied. Now, the reason why this is important is that if you diminish it, as I mentioned on the previous slide, that if you get a variant that diminishes by maybe 5 or 6-fold, and you are in a level of antibody that's as high as you see from day 28 through 35, you still have a considerable cushion to protect. Next slide. In fact, this was shown on a preprint server where David Ho and his colleagues looked at the increased resistance of SARS-CoV variants 351 and 117, but particularly with the 351, he demonstrated a 5-fold diminution of capability of blocking there, which tells you that a 5-fold decrease still keeps you with the second dose well within the protective range. Next slide. The next approach is booster doses of the wild type against the wild type virus, which is exactly what Pfizer has announced a bit ago and what other companies will also be doing, namely talking about a third dose of the original vaccine for those vaccine regimens that were a prime and a boost. And that's going to be given to participants in a phase 1 trial to evaluate safety, tolerability, and immunogenicity. That study will evaluate up to 144 participants in 2 age group cohorts. Next slide. The next approach is one that we spoke about a week or so ago, was namely develop a variant-specific vaccine. So instead of boosting up against the wild type, which gives you the cushion effect against variants that I mentioned just a few slides ago, the approach that has been taken by some companies, in this case Moderna, is to begin clinical trials of a booster shot against the specific variant in question. And in this case, it's the 351 from South Africa. Next slide. And in fact, as I have mentioned previously, this is a planned study that will begin in the middle of this month, and it will be a study that it's done in collaboration with our group at NIAID, in which we will look at both naive and previously vaccinated adults. And finally, the last is one that we look to the future, namely a universal coronavirus vaccine, one that would handle variants of SARS-CoV-2 and that would hopefully be able to address other pandemic coronaviruses in the future. I'll stop there and hand it back to Andy.
Thank you. Thank you, Dr. Fauci, Dr. Walensky. Let's take questions.
All right, we have time for a few questions, and please keep your questions to one question. My first one will go to Morgan Chalfant at The Hill.
Can you hear me?
Yes.
Great, thanks so much for doing this. I'm wondering if you can tell me how you came to the conclusion that there will be enough vaccine supply by the end of May to vaccinate all American adults, and why it was important for the president to lay out that timeline yesterday. And also just if there are any, if you're worried at all about setting expectations too high on that.
Thank you, Morgan. Well, look, we begin with, I don't think it's any secret that when we arrived here, Pfizer and Moderna were scheduled to deliver through, I think it was the end of September. Johnson & Johnson was well behind. And the president, as I think he's guided, has committed to getting the country vaccinated as quickly as possible. we got extreme levels of cooperation from private sector partners and everybody to say, let's follow the president's pledge, move forward and try to make sure we can get everybody vaccinated as quickly as possible. We are not in a habit of overpromising, and therefore, even as of several weeks ago, before such time as the approval of Johnson & Johnson, the president was talking about moving up the date till the end of July. All the while, though, we've been hard at work to try to take every idea we can, small or large, with Jeff Zients's leadership, with Dr. David Kessler's leadership, and the active participation of both Johnson & Johnson and Pfizer. And this is truly, I'm sorry, Johnson & Johnson and Merck. This is truly a story where there are no bad guys. There's only good actors here. Everybody got together and found ways to bring forward the timeline so we can get Americans fully vaccinated and into a very different place in a very different part of that pandemic. And I think the president has always said he's going to lay it out straight for the public, good news and bad news. And when we have challenges, we talk about them. And when we have advances, we talk about them. So that's how that came together.
Great. Next, we'll go to Brenda Goodman with Webmd.
Hi, good morning. I have a question about Texas. Yesterday, Governor Greg Abbott said that he was going to lift the mask mandate and open the state up 100%. And we know that now that all the variants have been found in Houston, according to some researchers who were part of a large genomic sequencing effort there. So I'm wondering, do you agree with the governor's assessment that it's time to open the state up 100%?
Well, let me begin with Dr. Walensky to talk about the CDC's perspective, and then I'll add some comments.
Thank you for the question. I think we at the CDC have been very clear that now is not the time to release all restrictions. I do think that, as I said in my remarks, the next month or two is really pivotal in terms of how this pandemic goes. As we scale up vaccination, we really do need to decrease the amount of virus that is circulating as we're trying to vaccinate all of the public. I will also note that, every individual is empowered to do the right thing here, regardless of what the states decide for personal health, for public health, for their health of their loved ones and communities. I would still encourage individuals to wear a mask, to socially distance, and to do the right thing to protect their own health.
Let me just follow that up. The president is committed to a few things. One is to follow the recommendation of the science and the scientists, and wherever that goes. And so the president is 100% behind Dr. Walensky and the CDC's recommendations. I don't think he could possibly be any clearer about the importance and the need for masks. As a leader, it's probably one of the topics he talks about most frequently. He models that behavior. He's made the order on every possible area where we have federal control, all the federal sites and facilities, transportation. And of course, last week we announced that we're going to be distributing masks to community health centers and food banks. We think it's critically important that particularly over the next period of time, this is not forever, but the next period of time when the president has called for this, we know that it can save tens of thousands of lives if people do this. And we strongly encourage people to continue to wear masks, and mayors, governors, and others recognizing that they have difficult decisions to make to keep the course. Next question.
Next question, Sabrina Siddiqui at Wall Street Journal.
Thank you, as always, for doing the briefing. I wanted to ask if you have a sense of when Merck will actually be able to ramp up production in terms of helping with the J&J vaccine, given the time it will take for the company to convert its facilities. And do we know how many doses Merck will be able to help manufacture?
Yeah, thanks, Sabrina. I think the answer is May. And again, there are two elements. There is the substance of the vaccine itself, and then there's fill finish. So it's a bit more of a complex answer, but over time, we believe that Merck will be able to double the capacity that we've seen from Johnson & Johnson heretofore. Next question.
Next, we'll go to Kristen Welker at NBC.
Hi, everyone. Thank you so much for doing this call. Really appreciate it. Wanted to follow up on the question about Texas. It's not just Texas that is easing restrictions. It's also other states like Mississippi, Arkansas, North Carolina, Virginia. So is there anything that the federal government can do? Is there anything that your team is looking to do to try to encourage, if not mandate, that these states reverse course? And also in terms of the May benchmark as it relates to distributing the vaccine, what are the potential headwinds that could derail that timeline? In other words, what are you concerned about most when you look to that end of May goal?
Thank you, Kristen. I think we have the same answer with regard to what our view on masks and what the president is saying and doing on masks. And so, I think we are using the absolute full extent of all of the areas where we have federal control, and we are actively being very, very clear on what we think needs to happen. And so we hope that other elected officials who have the authority in their domains will in fact listen. We're realistic enough to recognize that everybody's not going to pay attention to everything we say, but we think this is very, very important. In terms of Johnson and Johnson and Merck, I'm going to probably defer that question to the company. I think we have a good plan. I will tell you, we always worry about everything. I mean, it's sort of part of our ethic around here is execution mentality means that we are constantly worried. So anything that has yet to happen in the future, I can assure you, we have world experts from manufacturing, from the Department of Defense, and from the companies, all very focused on this. I don't know that I could point to one specific thing. Next question.
Next question will go to Raquel with TV Globo Brazil.
Thank you so much. Can you hear me?
Yes.
Thank you so much for this opportunity. My question is to Dr. Fauci, because Brazil is now having the worst time of the pandemic, and scientists around the world are warning that the COVID outbreak in Brazil is a global threat that could risk the progress here and in other parts of the world. Dr. Fauci, do you agree with this assessment? And also, do you believe Brazil could be doing anything different to respond to this crisis, especially when it comes to vaccination? Are you having conversation or working with authorities from Brazil?
Yeah. Well, thank you for that question. It is really a very difficult situation that Brazil finds themselves in, because it is really difficult in the sense that even with infection from the original virus that was circulating and recovery from that virus does not in fact protect you against reinfection from the circulating variant in Brazil. The best thing one can do is to get people vaccinated as quickly as possible and as many people as possible. You have to get your scientists and your public health officials to take a close look at the match between the antibodies that are induced by the vaccine that you are using and what its efficacy against the P1, P2 variant that is dominant in Brazil. So that's something that that I would imagine, and I'd be happy to be discussing this with your officials if you'd like to talk about what kind of options you might have. The issue with the impact of what goes on in Brazil and the rest of the world, obviously, when you have a variant that is in a particular country, and we already have the Brazil variant in a limited extent in our own country, that's the reason why, as I mentioned literally just a few minutes ago, in our vaccination program, we aim to get the highest titer of vaccination that would then be able to give a cushion of protection even against the variants. And as I mentioned, the recent paper that came out from Dr. David Ho's laboratory in New York indicated that there's a diminution in the capability of vaccine-induced antibodies to protect, but it is a modest diminution, which means that it is likely that the cushion that you get from 2 doses of an mRNA vaccine would likely be able to protect reasonably well against that.
Thank you. Next question. Kevin, do we have any others?
We can do one more. We'll go to Chris Majarian at the Los Angeles Times.
Hi, everybody. One more question on the states that are reducing their own restrictions. Specifically, are you in conversations with these state leaders urging them not to do this? Are they disagreeing in these conversations with you? I know there's only so much the federal government can do to order states to do things, but what is happening behind the scenes to urge them to not do this?
Well, I don't have a hugely long answer for you. We are in constant conversation with the states. And suffices to say that there are plenty of people, health officials, as you know, in every state who feel now is the wrong time to lift the mask mandate. I know it seems counterintuitive to folks to hear good news in the coming of vaccines and the acceleration of vaccines. We know, as Dr. Walensky said, that people are tired and eager for this to be over. But even though it's counterintuitive, it's actually the most important time for people to make sure we run through the tape and finish that up. I think that's a commonly shared sentiment, not just from us, but from public health experts everywhere. So hopefully the country will continue to rally together in this front. I want to thank everybody for joining the call today and appreciate all of the questions and the good work. Talk to you Friday.
I'll do what I can.
And Danielle's gonna get introduced over here. Let's just have her take her spot so we can turn. Okay, and then we can just take it. Yeah. I'm sorry. Great. So you're on that side. So folks, this is the setup. This is where all our people are going to be. So you can kind of work around that accordingly. And then obviously the vice president will be right there.
One to the right.
What?
One to the right also.
Yes. Yep.
So Marisa, can you raise your hand? So from her to the council member or the event participants in this semicircle, from here going to her.
Thank you. All right, now everybody knows. Can we get like a 2-minute in here? Yes. Hopefully.
Is she in Ralph?
Yes.
Oh, you did? Okay. How are you doing? Oh, I'll talk about that. For reading.
Should we stay here?
Thank you.
I said, we want him to bail. I'm like, you can stay right here. She's like, this isn't time for computer. Really?
Where is she?
She's in the corner. I told her she can stay on the there. You don't have to come up here.
Yeah, perfect.
Yeah, she's already right.
She has an engaged resident as well.
Engaged?
Engaged. Super engaged.
So I send a lot of emails is what you mean?
Pretty much. And Facebook comments.
Hey man, I give you
That's
money.
what I get.
I give you money so I can
I should
harass
get-
you on the
no.
Facebook. I get stuff done that way.
This should make a I shouldn't get
Yeah,
I
no,
shouldn't get
you're
an
actually,
email.
you're off the hook now.
I
You're
should
done.
get
You're
an
good.
email from you. I should
And
get
since Justin
posts.
keeps sending this to me, he's now down to, he is down to $1,900 in campaign contributions. And he keeps sending it. I'm like, now you're down another 100. And he's like,
He
this
doesn't have
doesn't
an
matter.
opponent. He doesn't care.
He's like, this is worth it.
Right.
Oh, God.
Okay, you're good.
You right there?
So you were actually now another 5 minutes up. Just kind of hang out there. Feel free to stay on the laptop, but that way I'm not going to see you until I'm complete. Thank you, sir.
see me? Okay.
I can hear your shoes. So why do they take even bother? Her house.
I know.
I like that jacket.
It's short and you show my ink.
Huh?
I like that it's short so it shows my ink.
I like it. I like the style. Actually, I've never seen it where it has the ends.
Yeah, like a.
So you don't have to like pull it up or
Yeah.
pull it or anything. I like that.
He's already picked on me for wearing jeans to meet the vice president. I'm like, dude,
No, I
this is
mean
who I am.
seriously, no, that's that.
I'm like, this is who I am.
Yeah, that's that old school like late '90s look. I
This is
love
like,
it.
I sell yarn. This is like,
Yeah.
I don't even own a suit. I guess.
She's ready. This is her place. She's good.
I hear sirens.
She's stopping by to pick up donuts. By the way, those donuts were awesome.
Yeah, I messaged Rob and said everybody was very excited about them, so he was happy.
Who's Rob?
Rob Capico is a state representative and he owns that donut. So he's not a state rep anymore.
He's not a state rep anymore, but his donuts were phenomenal.
Yeah. He opened a donut shop. He actually opened originally as part of the Sugar Shack brand, and then they went off that brand and changed the name to Elizabeth Town.
I think it was my number now. Because I love those donuts.
Yeah.
Like, how can I get some more donuts? So that store was like right around the block.
So it's up Route 1 on the corner of Madison and Route 1.
Oh, so it's nowhere
Kind
around.
of stuff, like kind of, no, it's like maybe, I mean, remember when 10 blocks up? Yeah, it's totally exciting. You got in here fast though.
That apple, whatever that was.
Apple pop over.
Oh,
Yeah.
so good. I'm kind of a connoisseur of donuts.
I live in the apartment complex that his donut shop is in. So it's literally, like we stop and get her donut holes before we go to school in the morning, like it's right there.
So I wrote a Yelp review on this one donut shop in downtown DC somewhere. I have to show it to you later, but oh my goodness, it's so good, but it's in the worst place.
Yeah.
Like nobody's gonna get to it.
That's nice.
Sir?
Madam Vice President, how are you? Welcome to Alexandria. I'm going to introduce you to folks. Okay, good. So come on in.
Thank you so much. Hello. Hi, everyone. Hi.
Hi, welcome.
This is one of our amazing business owners, Danielle Ramonelli.
Yes, I've read all about your
Thank
work.
you.
Hi.
Welcome.
It's nice
I know,
to meet
we
you.
do the elbow bump.
Whoa, this is beautiful. Look at
Yes.
this.
Come on over. I'll
Hi.
tell you about the
Oh,
shop.
is that where I am?
Yes, you're
Okay.
there.
Hi, I'm Kamala Harris.
Hi, I'm Maya.
Nice to meet you. Thank you. I'm Beth. Kamala Harris. Nice to see you. Thank you, guys. Hello. How are you? Nice to meet you. Thank you. Thank you.
So welcome. Thanks for coming to Old Town. We consider ourselves to be the capital of small business community within the DC metro area. So we are a boutique yarn shop. So we sell yarn to knitters, crocheters, weavers, and spinners. We really specialize in small boutique stuff that you can't find anywhere else. I've got yarns in the store you can't find anywhere else in the country.
I believe that.
And amazing
I mean, look at
local dyers.
Yeah. Oh, really?
Yeah, she actually has a colorway named after you. I'll show it to you.
Oh, okay.
It's called Observatory Circle.
I'd like to see what that color is.
So we really, the heart of our business is community building. So our classes and our workshops and our knitting help bar, similar to an apple bar where people can come in and get their stitches picked up. And obviously all of that sort of changed last spring. So we'll talk a bit more about that when you hear from my staff. So I guess I'll pass it back to you to tee off the conversation so you can hear from us.
Well, first of all, let me say I'm so happy to be here. I've read about your business and what you do. I mean, it is the story of small businesses, right? Which is, it's about a skill, it's about a gift, it's about a passion, and then it's about sharing that with community and doing it in a way that you bring the community in. I know about how you host events, pre-COVID, and this is the thing about small businesses, which is you really are part of the fabric of a community, right? But it's part of the culture of a community. It's a gathering place. It's a meeting place, and our small business owners are really not only business leaders but civic leaders. But I was particularly excited because you see, I was raised by a mother who said, "I'm not going to let you sit in front of that television doing nothing." And so I have crocheted more Afghans than I can tell you. Awesome. And our daughter is a knitter. So I was very excited to be here and to see this. And thank you. And let's hear from everyone.
Yeah. Maya, do you want to start?
Yeah. So my name is Maya. I was born on a naval base in Adak, Alaska. So I'm the daughter of a Gulf War veteran. And like a lot of people my age, I haven't been able to see my family in over a year at this point. And I've been working here at Cyberspace for over 2 years. And what really drew me here was the community space, of course. I left my previous very high-stress, high-end retail job to come here because I really fell in love with teaching. And that is a major aspect of working here is being able to teach. Being able to teach on the floor, and also being able to teach classes. So that is something that I fell in love with. And of course, this time last year, our entire business changed. And so we had to pivot extremely quickly in order to just keep our heads above water. So we switched from being a massive community space where people could just drop in and just hang out for hours into a web-based business, which is of course nothing that we ever wanted to do before. But luckily we had sort of a web frame already, so we were able to do that change pretty quickly, but it really has not been easy on us and the staff. So we had to deal with a lot of burnout from staff. And we had to just keep dealing with just learning new jobs on the fly, on days where we just had to, our jobs were just changing constantly, so we had to learn new skills very suddenly, and just keep thinking on our feet to keep the business running. So it's been a really tough year for us. Instead of just opening up our doors to the community, we've just turned into a place where we spend over half of our day just shipping out web orders constantly.
I bet that also challenged you in terms of thinking about how you do online. The work that you've been doing.
On the Postal Service.
Right.
Was a challenge.
God love the United States Postal Service, by the way, right?
He is wonderful.
That's exactly right.
Exactly
among the heroes of the moment.
Yes. They're overtaxed. So we're getting things to customers it's been difficult.
And so now luckily we're able to be open again to the public. But we're now in a position where we're still at the front lines of the pandemic, but have no prospects of getting the vaccine anytime soon as retail workers and as service workers. So it's still very high stress being in this sort of market and this sort of position. So.
Well, you know, the president announced yesterday, so by the end of May, we will have enough vaccines for everyone. And then we just want to make sure everyone gets them, and with a sense of urgency. Well, thank you for you keep coming back though, right?
Yes.
You kept coming back.
Yes.
That's the thing. That's the thing. And we're going to get through this.
Absolutely.
And it's people like you who help us get through this, right?
Yeah, we worked nonstop
Yeah.
throughout this entire pandemic. We basically never took a day off here. So, yeah.
Thank you, Maya.
Thank you.
Hi, I'm Beth. I'm originally from Omaha, Nebraska, and I'm married to a State Department employee who is a huge Warriors fan, so he wanted me to tell you, go Warriors.
Yay, go Warriors!
I wear I knit the sweater in Warriors blue for when we watch the games
You're
together.
kidding me. I got a jersey from Curry. I have to show you. I'm so, and it's 49. I'm like, that's not his number. And then I realized, well, it's my number.
So I'm a full-time yarnista. I've been here since October 2019, so I was just getting on my feet in the store when COVID came around, and I'm a 5th generation knitter because I also come from a nice Midwestern family that does not let you sit in front of the TV without being productive.
Right.
I'm also the mom to a very sweet, very high energy, almost 3-year-old.
Oh boy.
So when the pandemic started, he had just started at a new daycare that promptly had to shut down. And the reason he's in daycare is I work here full-time. My husband works full-time as well. We need daycare to be able to have our full-time jobs, and I need a full-time job to be able to pay for daycare in this area. And so when his daycare shut down, we had to come together as a family to figure out who's going to do this childcare role. Right. And I'm very fortunate that my mom made the sacrifice, like so many moms have made throughout history, that my mom took a hiatus from her job so that she could provide full-time childcare and I could still come to work. And so then because Danielle was able to get support from the government to keep our business open, to keep paying employees, to keep us open, even as we were shut down through the even as retail was shut down, we were able to continue to pay my son's preschool tuition that we were not using because we didn't want to put all of his teachers are women with families. Yes. We didn't want them to lose work either. So because we were still getting paid, we were able to be sure that they were still getting paid. And when money is invested in small businesses in a community like this, it stays in this community. And it helps the whole community during times of crisis. And now that we're back open to the public, my mom is living with us. She's no longer helping out with childcare as much. She's just, enjoying being grandma again. Yeah. But we're very much, as Maya said, on the front line of this. We deal with people every day, and we love dealing with people. It's why we got into this business. But it is very terrifying to think I could be the one that brings this home to my family, to my mom, who's over 65, to my son, who is just about to turn 3 and have his 2nd pandemic birthday where we're not having a party and these things. So we're very excited about the news about the vaccine because we want to be here. We want to help people. We have been seeing a lot of new knitters during this pandemic because we're at home doing things. It's a great stress reliever.
Yeah. It's also therapeutic.
Absolutely.
Yeah. And you create.
And so, and so we're here to help, but we all have families that we go home to too. So if we can all work together to keep our communities safe and keep our communities viable through these small businesses, it's very much appreciated by one little family and by lots of families beyond that are touched by it.
Beth, I did a meeting last night with a bunch of members of Congress, and the way it's exactly what you were talking about in your story. There's a really I think fantastic circle of connection, and that goes to a working woman, right? So women in the workforce, and if she is a mom, requires for her to go to work every day childcare. So then when we talk about childcare, there are 2 points, availability and affordability, both points you made. And then if we're talking about childcare, we have to talk about childcare workers, your point also. And are they being paid and valued for what they do? And then, interestingly enough, a lot of women-owned businesses are childcare. Yeah. So it gets to it gets to women-owned businesses, which of course gets to the support of small businesses. You just outlined it with your one story in such a beautiful way, like all the dimensions of you coming to work, and coming to work in a women-owned business that probably also serves a lot of the women in the community. Yep. Like it's just a really interesting ecosystem when you think of it that way, which you just outlined so beautifully. Yeah. Thank you.
Hi, good afternoon, Madam Vice President. I'm Marisa Potts. I own a small boutique marketing communications firm here in Old Town called Spotted MP. And I serve women-owned businesses like Danielle in sharing their communication, their stories that has been going on. And I've been with Danielle since she's opened the store a decade ago. But when you touch on women-owned businesses, it hits really home. I'm also a mom to a 12-year-old son. I'm a wife, and I'm running my own small business here in Old Town as a Black-owned business owner. But during this time, majority of the businesses in this town are women-owned. And during this past year, I have been on the ground and assisting these women-owned businesses with telling their stories of their impact and the challenges and the innovation as well that has been happening.
Right.
There's women that, like Danielle and myself, where we have to bring our kids in to work while we're trying to make a sale.
We'll get her.
Yeah.
Maddie.
There's Maddie. Yeah, so there's so many women here that they're forced to bring their kids into work just to try to make a sale, to just having to close their business on a off day because they don't have childcare, or just having to make deliveries, online deliveries, to their customers with their kids in their car. I mean, this is just examples of what some of these women-owned businesses here in Alexandria having to face, and the seat that I sit in to communicate these challenges and even help with these women businesses trying to work together. But, community is so important, and I know as a women-owned business owner, we thrive off of that. And to be inside retail and create those events and those safe spaces where we build community is what we're all about here as women-owned businesses. And so just having an online presence is just not an option, because it's our livelihood that we have to have for the vitality to thrive, because it's been extremely challenging here for the women here that run businesses.
It's interesting. I have traveled, especially before COVID, a lot around the country, and but women-owned small businesses around the country are describing exactly the same thing. There's a group of sisters that, for example, they have a juice bar but all over the country anyway, and just that, no childcare because of COVID, and bringing their kids then to work, and it might be a storage room, it might be the back room, and then setting them up with a laptop, because you got to just make everything work, and to your point, be innovative. But it really does also highlight how much in so-called normal times women are juggling. And it might be their children, it might be that they're in what we call that sandwich situation, right? Generation, where it's their parents and their children. And it's a lot. It's a lot. It got voted out of the House, and we're now hoping that the Senate passes our American Rescue Plan. And a lot of it, and the way the President and I think about it, is that we have to understand who, to your point, are the folks who have been sacrificing so much on the front lines, and really are part of not only the economic engine, but to your point, the vitality of community.
Yep.
And so we have, for example, as part of the American Rescue Plan, $15 billion that goes just into small businesses. We've been paying a lot of attention to the fact that during COVID, 2.5 million women have left the workforce. And we are afraid, almost maybe some of them permanently, until we work all this stuff out, right? That's why we're also pushing for the $1,400 relief check. But it's also about, to the point of everybody's story, seeing how this pandemic has really highlighted the fissures and the failures of the system even before, right? When we don't have a system that it says everybody should have paid sick leave, paid family leave, right? A system that says we should value people for the work they do, understanding if they are helping the economic engine run because they're taking care of the children of working people, that they should be, given the value and the dignity that they deserve for what they contribute to families and to communities and to all of society. But that's part of what we're doing in pushing for the American Rescue Plan. Also vaccinations, we made an announcement yesterday, the president made an announcement, priority for educators before the end of March. And educators understanding that it's bus drivers and it's the cafeteria worker and it's the teachers and the support staff. But there's a lot here, and part of, again, what we're doing is we want to make sure everybody knows about the American Rescue Plan, because a lot of it is about making sure that we get support to schools, and we also have a real attention as a priority to what we also need to do that is about eventually growing around universal pre-K, and so that your baby can have those options. Yeah.
So some of the challenges that, or kind of benefits that we had in the spring of last year that sort of kept us going, we did receive a PPP loan right at about the time when I needed to start laying off my staff because we were closed to the public. And that allowed me to keep everybody on board. We also received the EIDL disaster loan, which gave us some working capital, which was wonderful. So spring was, my daughter was obviously home from school all of a sudden, so balancing my daughter at home, constant barrage of messages on grants to apply for and loans to apply for, and figuring out that process, because that was a whole new world. We were also really lucky. This building was purchased with an SBA 504 loan, so that that payment was deferred for a series of months, thankfully, through that through the SBA. And then my bank, which is a local regional bank, also deferred our loan payments. That's really how we stayed in business over the spring. And then we also, the city of Alexandria took their CARES Act money and invested it in small businesses. So we received 2 grants from the city, one to completely overhaul my website, because our web store, there's a lot of tiny objects in here. So our web store was not set up to do this. So that was a huge benefit.
And they came in after March of last year.
Yeah, this money came in, we received the grant in, I believe, November. We were in the second round of that grant money. We also received a second grant from the city to expand our outdoor space so that we could try to replicate that community gathering space outside where it was safe, because the lounge that once was in here we couldn't use. Our customers couldn't be here. But even with all of that, you know, retail sales, even with COVID in 2020, retail sales online, web stores, was only 20% of consumer spending. So in a small business, that's more like 5 to 10% of their income. So shifting to online does not replace what happens in businesses like this, where people are here buying because they don't need yarn. They want to have an experience. And so we really can't get back what we lost until we can be fully open again.
And so much of your business is tactile.
It's all tactile. You need to be able to feel it and really see the color. So our biggest concerns right now are obviously the safe reopening of schools, which would help customers, staff, and myself. We're fortunate that the Campagna Center, a local nonprofit, is offering full-day childcare. It is a huge expense on our family, over $1,100 a month. But it gives my kid some normalcy. She's with other children, and I'm able to run my business. We are only a team of 5. There's 3 people here each shift, which means if we have a COVID case, my entire staff is gone.
That's right.
So I am working from home so that I can at least be here and get the doors open for a couple hours. But that's a huge concern. When the Families First Act runs out at the end of March, I am no longer covered to pay that staff. So having that extended beyond March is really crucial. We need to be able to pay. We need to be able to pay them without it being a huge burden, because to pay 5 staff members who are not here is obviously an enormous burden on the business. So those are sort of the priorities, you know, beyond what they mentioned about vaccines as well, obviously, because we're directly working with the public every day. Those are kind of the things that we're most nervous about headed into the next few months. So.
We are all nervous about that, which is why we have to get this act passed. And it is, you know, some people say stimulus. No, this is literally about relief for people who need it right now. But I don't need to tell you all that. I don't need to tell you that. And it is about everyone. It is about, you know, it is about working people. It is about families. It is about small business owners, community leaders. You know, and I do think that it's going to be interesting to see how history will talk about this moment. But one of the things I'm certain of is that history is going to talk about the angels walking among us, that maybe we didn't see them before, but we see them now. and we will call them heroes. And it's going to be our small business owners. It's going to be our working parents. It's going to be the people who came to work every day, not sure, you know, what kind of risk you were taking, but you knew you were performing a very valuable service for others. It's going to be the postal worker. It's going to be, right? It's going to be, yeah, we're going to talk about really incredible heroes, right? I like to say, you know, who we didn't realize, but now that we look closer, we can see they were actually wearing a cape. Right? So, well, thank you for sharing this. And this is really, it's wonderful. And I tell you, the president and I feel so very strongly, in particular, about our small businesses. I don't need to share with you, but for the rest of everybody, 50% of America's workforce works for a small business or runs a small business. And, you know, and it's the place where you can go where, you know, I'm going to sound like a commercial for a very old TV show, but where everybody knows your name. Right. Right?
My customers are across the street.
Right? Yeah, but it's true. Where they can kind of, you know, or if it's the local restaurant where they can see you had a hard day and you don't even have to look at the menu, they just put down in front of you what you like to eat, right? Yeah. It's so much a part of the fabric of community. Yep. So thank you for sharing this with us. Thank you so very much. Thank you all. Thank you.
How did this come about? Oh, this story? Yeah. Oh my gosh, I have a master's degree in public policy.
So I think this is probably, well, for you, you can see more of the building on this side. What's that, Peter? You can see more of the building on this side. You want to come over here? See more of the building.
You're exactly my opposite. Yeah. See the tree? He's great. The tree's good. This guy's a little wrapped around it. Just give enough room to do it because I don't want to come through it. You get it. Doesn't help you.
Can't tell nobody. No. I told everybody. I was like, I can't bring it. I can't bring it. No, I'll vouch for you. I'll vouch for you.
I mean, the cheapest bus best thing I've ever had.
My 33rd. Woo! All right, I won't be mad at you. You earned it, no question. I got a couple more. I mean, I bet your mom. Yeah. The way through. That's right. The way you're little. I don't think you had a gray hair in your hair. Back then.
Come on! What's going on? How are you? Did we get good photos? Where's this?
We need one more.
We need one more? Okay,
This is
yeah.
Deputy Chief Police right here.
Oh my goodness. We will do that. We will do that.
Deputy Chief.
Oh, thank you. Michelle, nice to meet you. This is the Deputy Chief of the Police Department. Nice to meet you. Thank you, sir.
Thank you. Yeah. Anytime. Anytime. Anytime you guys want to talk about dinner,
You all will step up here.
you guys go.
Thank you so much.
Hey, how are you? How are you doing? Hi.
Nice to meet you.
Meet you.
When we get done here, do you want to get a shot of that line that's going back to us? What do they talk about? Right. You know, maybe that's, yeah.
Oh, yeah. How you doing? Good. I guess they
Good afternoon, everybody. I'm just giving everybody permission to record, and then we'll get started. Okay, we will begin in 5, 4, 3, 2, 1. Lorna, over to you.
Good afternoon, everybody. Thank you for joining us again on our weekly COVID-19 briefing with Montgomery County Executive Mark Elrich, Dr. Travis Gales, our health officer, and also Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security for Montgomery County. I am Lorna Vigili, Hispanic Public Information Officer. I will be hosting this briefing today. And members of the media, you should already have permission to record. If you do not, please ask for it on the chat and use the chat later on for the Q&A portion of this presentation. With that, Mr. County Executive.
So I just want to welcome everybody and thank you for joining us again today. In a couple of days, I think we know that we're going to be acknowledging the 1-year anniversary of the first cases in Montgomery County. If people remember, this started with 3 people who came back from a cruise in the Mediterranean and up the Nile River. And those were our first 3 cases. And now we are sitting here a year later. We've had 63,000 cases, about 1,400 deaths. So the world has, radically changed since then. When we were doing things in the March and April timeframe, and we set out an economic recovery program, everybody thought this was going to be over in May or June. And when we were in, late May and June, we were talking about were we going to reopen for the 4th of July and have the 4th of July celebrations. And here we are a year later, not only no celebrations, but we still have limits on indoor and outdoor gatherings. And the virus is very much with us. But things are definitely improving, not as fast as people would like, but they're improving as fast as they can improve, because at the end of the day, our ability to vaccinate people depends on the ability of the pharmaceutical companies to provide vaccine. They, are all contracted with the federal government. The federal government is putting out vaccines pretty proportionately. So it's not that the federal government has favored children and unfavored children at this point. It just doesn't have enough doses, and those doses go to the state, and then the state apportions it down to the county level. So until there are more doses produced, we are going to continue to move slowly. The good news is that this week we will be receiving our first doses of the Johnson & Johnson vaccine. I think it's about 1,600 doses. We're not sure whether that will be repeated next week or the week after that, but we do know as soon as their production's ramped up, that we'll be seeing more of the Johnson & Johnson doses. We know that both Pfizer and Moderna have said that they're increasing the speed of their vaccine production. And so overall, over the next month or so, we should see a rapid increase in the supply of vaccine and our ability to get it out. I know there's been a lot of discussion about clinics and mass vaccination sites. We've been very clear that we're ready to do a mass vaccination site in Montgomery County. And if the governor, if they're having issues with logistics and the deployment of people to do that, all we need is the vaccines. If we're provided the vaccines, we will open up a mass vaccination site in the county. we're ready to do it. We've got a clinical partner, a hospital that will work with us. And so we're ready to go. We just need the doses to make that happen. But I do think, that the approval of the Johnson & Johnson vaccine moves us closer to a light at the end of the tunnel. I think people can begin to see that the vaccines and the doses are coming online. So far, we've vaccinated 161,000 residents in the county who've received their first dose, which is the most in the state, and nearly 80,000 residents have received their second dose. More than 15% of county residents have received both the first dose and almost 8 have received the first dose, and 8% have been fully vaccinated. And if you take out the young people, 17 and younger, which is approximately 22% of the population, the percentage of the eligible people in the county actually goes up substantially. A little over 70% of the estimated 73,000 Montgomery County residents who are older than 75 have received their first dose of vaccine. Again, the county was the only provider that was focused on making sure that these residents who were in the first public tier, as opposed to the employee tier of front-facing workers and healthcare workers, this is the first group that was targeted for vaccine, and we've gotten 70% through with our roughly 4,500 doses a week ration. Approximately 45% of the residents who are between the ages of 65 and 74 have also received their first doses, primarily from hospitals and pharmacies, and to some extent from the other mass vaccine sites around the state. Again, pointing out the state hasn't provided us with one directly in the county. And based on this progress, our county-run vaccination clinics are starting to vaccinate residents who are in the next tier of eligibility, which include essential workers, and we'll begin scheduling people who are pre-registered. So this will be coming very soon. We remain focused on equity, and last week we continued to distribute vaccines in areas of the county that have been hard hit by COVID cases. If you look at the census maps, you can see that while the county has a good average, and we do well, in terms of positivity and number of cases per 100,000 at the state level. When you look at us as a county, when you look within the county, you see real serious disparities between parts of the county where the cases are very, very low, which means the chances of a person running into somebody in the course of just being in your neighborhood who has COVID are pretty slim. But there are other parts of the county where the cases are much higher. Much of that is in communities that provide the workforce for the stores and the restaurants and the other places where everybody goes, which is meant to just try to underscore for people why the importance of vaccinating people where the number of cases are the greatest, because those are the folks who are most likely to have contact in the course of their jobs and their work with everybody else in the county. And that happens to overlay with the racial equity concerns that we've had, that statewide and nationally, people are not doing a really great job in terms of making sure that doses are being equally taken up by people of all ethnic and racial backgrounds. And so we've been working to make sure that the county does have a focus on making sure that everybody is getting access to the vaccines. And that's why we've worked with community partners to bring that message in deeper in the community. And it's why we've set up, phone lines, multilingual phone lines, so people can call in and get information if you're having trouble or don't have the ability or access to a computer. Our health department stands ready to get more doses, and we're certainly ready to go beyond the capacity we have right now. And we've demonstrated again last week when we got 2 weeks worth of doses, those doses are all out. We have consistently been able to support the community in getting these doses there. I know how frustrated people are. I think people confuse when I say, or we say we have 15,000 doses. They think the county has them. They think the county controls the scheduling. The only schedule that the county can control is its own schedule. We've got people re-registered. We send out invitations to schedule for the 4,500 doses that we have. But the other 10,000 doses a week that are available right now are going out through hospitals and pharmacies that have their own scheduling system. I wish we had a unified scheduling system. We've raised this issue with the state. We believe that you ought to be able to sign up, pre-register, and then go ahead and register when doses are available. You should be able to register once. You should see in front of you all the places in a county or the state, if you're willing to travel, where appointments are available, and you should be able to make the appointments. Unfortunately, the state does not have that system. And so they've left everybody to produce their own systems of registration. And the county actually has to go through the state to complete the registration for our people for scheduling vaccinations. So it's not run optimally. We think there are improvements. We've asked for improvements. We're hoping that the state makes those improvements, because this is something we could get right. And the state has not managed to get this end of this equation to the point that we think it should be. We continue to have our focus in the county on limiting transmission. We've been very cautious about reopening things for that very reason. And, we are very concerned, as if you've heard from, the national health experts about the caution the CDC is urging on not opening more things up right now. We've got variants. You've got a Brazilian variant, which is very worrying, a South African variant, which is very worrying. You've got the UK variant, which is a problem. And then you add a New York and a California variant. And remember that one of the reasons we think COVID took off so quickly in this area is the massive amount of travel that occurs up and down 95 between New York and the DC area and farther south. It's kind of a conduit. So we're very concerned about transmission, and we're very concerned about the new variants because they don't respond as well to vaccines. So it's really, really important that people minimize their exposure, do everything we've been asking you to do. These variants don't go through masks any better than any of the other variants. But what they do is they are more likely to spread if you get in contact with the virus. And there's evidence that they may reinfect people who previously had COVID. We want to knock all this down as quickly as we can. So we're asking you, do not travel during spring break, Passover, and Easter. This is like the winter holidays. We've got to get through this without bringing back more cases and causing another spike, particularly if the result of travel is that people start bringing back cases with more of the New York variant and the Brazilian variant. And all these things are here. It's not like they're not here. If we start bringing more back into this community, we could very well see another spike again. We don't have enough vaccines out there to have herd immunity or anything approximating that. So I'm urging people to please extend the caution that so many of you have shown throughout this, extend it through these coming holidays. We really want to do the things we're not doing now in person next year. We want people to be safe, and we want the folks who are hearing this now and getting this message now to be around next year, to hear different messages and to have life more normal, as all of us would very much want. So please pay attention to the guidance and follow the guidance and keep yourself safe and keep the people you care about safe. We continue to urge people to get tested. We focused on this throughout the pandemic. Now we have tests. We are seeing a drop off in testing. I think people think that with the vaccines, they don't have to worry so much about testing. It is still a critical part of our strategy because we need to know where the virus is. And because you can still get the virus, you need to know if in fact you're positive. Waiting for the vaccine, you can still get sick while you're waiting for the vaccine. The virus doesn't care that the vaccine's available to you. The only thing the virus is going to determine, do you have antibodies or don't you have antibodies? And if you don't have the antibodies, you are vulnerable. So don't put yourself in a situation where you don't know whether or not you're safe right now. So that's where I'll stop now and just hope that everybody can be patient. And I look forward to your questions. Thank you.
Thank you, Mr. County Executive. Dr. Gales, do you have
Good
some opening?
afternoon. Good afternoon and happy Wednesday, everybody. Always a pleasure to be with you all. I will keep my remarks brief. I did want to focus on one particular thing related to the Johnson & Johnson vaccine. But as always, I would just like to extend a special thank you to all of our staff who continues to work on all levels of the pandemic response. But given that our school health staff will be going back to support the schools as they reopen, I did want to take a moment to say a special thank you to all of the school health staff who quickly pivoted from providing services in the schools, the early stage of the pandemic, and have been supporting all of our efforts of response, from contact tracing, the call center, to helping support testing clinics, as well as our vaccine distribution process. Thank you for your dedication. Thank you for your input. And we certainly will continue to utilize and leverage your expertise gained as you all move back into the classroom. So I did want to just make some brief comments related to yesterday. We did put out information to say that the state would be receiving doses from Johnson & Johnson. The state will receive approximately just over 49,000 doses of the single dose vaccine, and the county expects to receive approximately 1,600 doses. I do not believe as of this morning we had actually received those doses, but we anticipate that they will be coming in the near future. And we've been asked to hold off on putting them into circulation until later this week as the state builds up the registration system to accommodate those. I do want to clarify one thing that the county executive mentioned. The federal level is pushing out all of the doses available this week to jurisdictions, and we have been notified that because of that, it is likely that we will not receive doses next week or the following week to allow for the manufacturer to resupply those doses that have all been shipped out or in the process of being shipped out to communities today and tomorrow this week. But one of the things that I wanted to address, because we will start scheduling clinics, we already are ready to go with that and are waiting for the official green light from the state, is that there is some conversation that says, well, the Johnson & Johnson dose is inferior to the other ones, and I don't want to get that one, I want to get the other two. That's not accurate. And so I want to just take an opportunity to clarify a points. Now, the Johnson & Johnson vaccine is the newest of the vaccines that have been approved to make it through the process. It also means that it has been in its clinical trials of over 44,000 individuals in the United States, South Africa, and Latin America, has been tested in a setting where we do suspect that there were an increased number of the variant strains that the county executive mentioned. And the data suggests, similar to the other two, that it has good results in protection against those particular variant strains. Now, there have been some concerns to say, well, the efficacy is 66% versus 94% and 95%, but let's take a look at the numbers a little bit differently. The Johnson & Johnson vaccine, and within the first 2 weeks of administration, was 85% effective against severe disease and 100% effective at preventing death secondary to acquiring COVID after being vaccinated. And a month after receiving that single dose of the vaccine, the data shows that there were no hospitalizations related to COVID for any of those individuals who had received the vaccine. And that's important to note because, one, it suggests that protection against the virus comes at a quicker time period, if you will, in comparison to maximize the effect in comparison to the 2-dose regimen. And again, it is effective at preventing severe illness secondary to COVID-19, if one gets it, and very good about nearly 100% at preventing fatalities as well as COVID-related hospitalizations. And that's ultimately the goal of the vaccine, is to keep people safe. None of them are 100% in terms of preventing an individual from getting it. They all have met the 50% threshold that the FDA has cleared, and they are all, including the Johnson & Johnson vaccine, have high numbers, 100% again, in terms of preventing hospitalizations after a month of acquiring the vaccine and significant reductions in severity of illness, as well as COVID-related fatalities after being vaccinated. And so I just want to hammer home those points. that it's important for folks to understand that getting one versus the other is not an inferiority or a second-class opportunity. As Dr. Fauci mentioned, he would encourage individuals to take advantage of vaccines that are made available to them to provide protection and coverage. And so I just wanted to take that opportunity to clarify that for the folks watching at home. And the other thing that I would also like to mention as it relates to vaccines and open up for questions is that we are beginning to, we have doubled down in the last week to send out registration links to our residents who have pre-registered over the age of 75 to make sure that we're not missing anyone. As the county executive mentioned, we have over 70% of those individuals who've actually completed the vaccine that we are aware of, including part of the county, the other vendors throughout the county, and potentially at other sites throughout the state and other places. We are beginning the process of moving to our next set of priority groups, including those, if you go back to our prioritization framework, those in the essential employee categories across a number of different industries, as well as those who are over the age of 65. So as we continue to move through the rest of the week, we will continue to work to, again, apply our equity framework within that and continue reaching out to our employers of those respective industries. We've had previous conversations with those industries to get an understanding of how to prioritize within those groups again, because we don't have enough supply to cover everybody. But that is where we're moving, and we're excited to be able to, at least from the county perspective, be able to offer opportunities for individuals within those groups to align with their eligibility or availability to receive vaccines in other places throughout the county. I will stop there. Happy to answer any questions. Dr. Stoddard, I believe the floor is yours.
Thank you, Dr. Gales. Thank you everyone for having us back and being here. Just to give a couple of additional updates, we've been working very closely with Montgomery County Public Schools as they prepare their, they initiate their reopening this week and move into their next phase of reopening planned for March 15th. At this point, the partnership with Hopkins has proved it's accelerating both with our public schools and our non-public schools. So far for our public schools, I know many have asked about that, about approximately 11,570 invitations to receive a vaccination have been offered. This does exceed the 9,000 that were required for the March 15th timeline. In addition, I know that Johns Hopkins has asked the public schools for an additional 2,000 persons to be in to invite. And the county has actually asked for approximately 4,000 names off of their list as well to try and expand that vaccination effort for their April 1st and their phase 3 and phase 4. Similarly, we have already collected lists for the non-public schools, both for Johns Hopkins as well as the county health initiatives. And we'll be expanding those efforts, as Dr. Yale said, as we complete the 75 plus, we will be moving into the 65 and over, as well as some of these essential workers, including our educators. As discussed at the federal level and the interest from the Biden administration to have educators vaccinated by an April 1st timeline, we believe within Montgomery County, we will be able to meet that timeline, both for our non-public and our public school systems. And that's the goal that we're going to try and meet, and we believe we will meet. And so that's all I wanted to add to the discussion that we've had today. Happy to take questions at this point.
Thank you very much, gentlemen. So reporters, remember to use the chat to ask permission to ask questions and also identify the organization you represent. First question comes from Tom Fitzgerald, Fox 5 DC. Questions for the county executive and also Dr. Gales. Tom. You need to unmute, Tom. Apparently he's muted. You're muted? Okay, can we unmute Tom? There you go. There.
Thanks for doing the call, everyone. Good to see everyone. County executive, I wanted to ask you more about this mass vaccination site that the county wants from the state. You had said earlier there are no favorite children here, but the state is announcing these mass vaccination sites. They are not here. You've expressed that you have, the ability to do this at the agricultural center. Clearly, it's the most populated county in the state. I'm curious as to what you're hearing about why this is not happening. Why is Montgomery County not getting this site? And I'm curious as to whether or not, you know, there's any bad blood or anything going on here from past disputes over, you know, you name it, 270, the schools opening or closing, or whatever has gone on over the last couple of years. Yeah. What in your gut, what do you think's going on here?
I don't think it's any of that, because I will say, you know, that the county works with the state on a number of different issues. And while there are some things we disagree about, we have really good cooperation on other things. I mean, I can talk about my housing department working with the state housing department, our economic development group, working with the governor's people who focus on economic development. You know, soon you'll be hearing about something we're doing big way in economic development we've engaged the state in. So, you know, I've always said from the beginning that even when Hogan and I disagree, it does not trickle down to the rest of how we do business with each other. And I give him credit when I think he deserves it. I thought he took, you know, a really important lead in this in the beginning. You know, we began to differ as time went on, but we differed. You know, you differ and then you go on about your business. So I've been okay with that. I think, you know, the only thing I can ascertain is the state's tried to deal with places that have the least ability to set up vaccination facilities. And Montgomery County's clearly demonstrated that even in the absence of a mass vaccination site, we vaccinated more people than anybody else. We'd like to vaccinate more. And we have, you know, because we do have this disproportionate number of cases, that doing things by your percentage